And next, everyone is muted, but we encourage you to use the chat for comments or questions. You can save the links that we'll be placing in the chat yourself, and staff will be sharing them with you after the call. Share your thoughts and kindly and respectfully engage with others. If you feel the chat is distracting, just close it. Now, feel free to use the reaction emojis that you can click like this. Look for the happy face with a plus sign in the lower part of your screen. And if you're using a tablet, an Android, or an iPhone, search for the three tiny dots for options. If you're experiencing any connection problems, we recommend you turn off your video to save your bandwidth. And lastly, I encourage you to switch to gallery view to see all participants on your screen. Go to the top right corner of your Zoom meeting window and click on gallery view. Even though we'll be spotlighting with the screen focused on the speaker, you can still change back to gallery view if you prefer. Now, again, thanks for being here. I hope you all have a beverage of choice for this hour of the morning. And the purpose of today's call is to have fun, as we always do, to build community through inspiration from our concerned fellow members, to learn from our speakers, to hear your stories, and to network. Now, I'd like to introduce our Executive Director, Beatriz Sosa Prado. B.
Hi, good morning. I just had to clear my throat right there. It's early on a Saturday morning, and so I appreciate you all for being here. And so my name is Beatriz Sosa Prado. My pronouns are she, her, and hers, and I'm CAPA's Executive Director. I'm calling you from LA, and I am thrilled to be on this call this morning connecting with you. I hope that you and your families are safe, are well, and are thriving during these difficult times that we're seeing in our country and in the world. CAPA was founded in the San Francisco East Bay area in 1987. Many of you know that. It was founded by progressive doctors who believed that we could improve healthcare for patients by improving our healthcare financing and delivery system. This year, we are celebrating the 35th anniversary of our commitment to healthcare justice. CAPA envisions a just and equitable healthcare system that is truly universal because everyone deserves healthcare. Our mission is, and that is that the work that we do is indicated by our three-pronged approach, and it is critical to help us achieve that vision. One, we organize and advocate for just and equitable healthcare justice system in California. And two, we support legislation that proposes to make positive impacts in our healthcare system. And three, our student organization, the California Health Professional Student Alliance, CAPSA, helps Californians get access and coverage to healthcare right now. And before I continue, I am going to introduce the diligent and dedicated CAPA staff that I am so proud of. I'll call them by their first name in alphabetical order, and we'll hear from them. So I will go ahead and start with Bethlehem. Hi, Bethlehem.
Hi. Good morning, everyone. Like you mentioned, my name is Bethlehem. My pronouns are she, her, hers, and I'm joining you all from Los Angeles. I am the CAPA's administrative assistant, and you'll be hearing a lot from me if you already haven't. So I look forward to working with you all. I'm a recent graduate from UCLA and a pre-med student. I came to CAPA because in my undergrad years, my conviction for healthcare justice was solidified. I asked my public health professor to point me towards some opportunities after I graduated, and she pointed me towards a big investor in nonprofit work, which is the California Endowment, and that led me to CAPA. So I'm really excited to join CAPA and the work that we do here because I really believe healthcare is a basic human right and everyone deserves accessible healthcare. A little fun fact about me, let's see, I own 2 ferns called Fernie and Ferdinand.
I love it. Thank you so much, Bethlehem. I love that. I am also a plant mom. Yeah, Bethlehem and I have lots to talk about when it comes to plants too. Okay, next, Jackie. Hi, Jackie.
Hello, everyone. Good morning. I am Jacqueline. I usually just go by Jackie. My pronouns are she, her, and I am joining you all from Santa Clarita. And I am CAPA's program coordinator. Just a little background of how and why I came to CAPA. So when I was in grad school for my master's in public health, it was towards the end, I was searching for a job, and one of my professors actually emailed us a job description of CAPA. And when I started researching more about CAPA on the website at the moment, one of their core values really stuck out to me, which was healthcare is a human right. And that's something I strongly believe in. Going through the program, I have learned a lot of how the healthcare system works and how it is in need of a repair. And I support universal healthcare because, again, like everyone deserves quality and affordable healthcare. And that's something I strongly believe in as well. And some of my future plans, I do hope for someday to work for the California Department of Public Health. And a fun fact about me is I am half Mexican and half Japanese. And again, thank you all for being here with us today.
Thank you. And then to remind everyone to use emojis, go to the bottom portion of your screen and give our staff a clap or a heart, a happy face. Okay, next we have Yessie. Good morning.
Morning, B. Hello, everyone. My name is Yesenia Buenrostro Ramirez. I am currently serving as the CAPSA coordinator. I am speaking to you all from Selma, California in the Central Valley. And so how I found out about CAPA, I was actually through mi mentor. I had stumbled upon a post and then I followed the account, the CAPSA account on Instagram. And so I was actually started off as a volunteer back when Farouz was still CAPSA coordinator. And I helped during one of the first Medicare events that was held virtually. So it was really nice to, like submerge myself in that aspect. And then I did more research into the org, and then again, as my coworkers mentioned, as my team members said, the thing that really stood out to me was healthcare is a human right, and I truly believe that. The reason I support, Versa Healthcare is because I firsthand witnessed a lot of my family members and friends who were undocumented not have access to the healthcare services that they needed. And so for that reason, I do believe that everyone should have access to it. And my future plans, I hope to become a doctora. I do have an interest in emergency medicine or surgery, so we'll see what happens there. But and a fun fact, I have a minor in deaf studies and I know basic American Sign Language. And thank you all for joining us today.
Wow, that's amazing, Yessie. That is something that I feel like I didn't think about before, but as I learn more and more about your background, I just think that's great, that deaf studies and sign language, that's amazing. So as everybody could see, our staff is equipping themselves to serve in our future healthcare system, the healthcare system that we want to see. I will go ahead and tell you a little bit about CAPA to those of you that are new or just need a little reminder about who we are before we move on to our guest speakers of today. So through our 35-year history, we have acknowledged the negative impact of people not having health insurance, right? Different communities lacking this very important resource, especially in our communities of color. We have focused on educating and advocating for universal coverage and single payer legislation since 1987. Now, after the ACA passed in 2010, almost 12 years ago, we acknowledge that it advances health equity, health workforce development, and cultural competence in our healthcare delivery systems. We know that it's not perfect, but it's an improvement from what we had previous to that. CAPA is committed to working with our partners to implement the ACA coverage successfully and to find solutions for the 3 to 4 million Californians who are still left out of the system, including a segment of the undocumented population. Now, and without a single payer bill in the state legislature, what California Physicians Alliance did is that we pivoted and supported expanded coverage to include undocumented children. Before now they're included in Medi-Cal, but this happened when we didn't have anything that took care of our undocumented Californians. CAPA worked to expand Medi-Cal to cover undocumented children, then undocumented young adults under 26. And then this May in 2022, income eligible adults ages 50 plus, regardless of immigration status, became eligible for Medi-Cal. And CAPA continued to fight to close the age gap between 26 and 49 years old, right? For Californians, regardless of documentation status. And finally, this adult group will become eligible for Medi-Cal on January 1st, 2024. Because of the history in healthcare justice, this doesn't seem like it's far enough, but for those people that need access to healthcare right now and deserve it, we're a little over a year away. That is still too long. People need healthcare now. So the work that we did for advocating for undocumented Californians were included in our public healthcare system was in collaboration with the Health4All Coalition. Our first speaker, Iván, will tell us a little bit more about this coalition later. And now I want to talk about CAPA's roadmap, which you have heard about this document, right? CAPA's roadmap to Golden State Care is a document titled Strategic Steps to Get California to Universal Coverage and an Equitable Healthcare System. CAPA's roadmap provides a step-by-step plan to achieve a universal, high-quality, accessible, and equitable healthcare system that we are calling Golden State Care. To ensure that our state's transition to an improved healthcare system is as smooth as possible, this roadmap is carried out in 3 phases, focusing on 5 policy areas. Number 1, universality. 2, responsible private insurance company behavior. 3, reasonable costs and prices. 4, improved efficiencies in public systems. And 5, improved workforce support. That's why I also wanted our staff, I appreciate our staff for talking about how they will contribute to our future healthcare workforce, including public health. And now CAPA chose these 5 areas that I just talked about because they encompass the largest need for change and critical opportunities for constructive progress in California. CAPA's roadmap can serve as a tracking tool for progress towards universal coverage and an equitable healthcare system here in our state. The roadmap will be presented to the Governor Newsom, legislators. It already has been presented to the legislators, coalition partners, and the public. This roadmap can be downloaded from our website, and the link to access to this roadmap PDF, you can access it by going to our website, but we're actually going to put the link in the chat to access and download the roadmap. The renewed racial reckoning of 2020 that we saw then, it's been snowballing, right? And in 2020, this exploded. We became very aware about racial justice, that we need to do something about addressing that in healthcare. And also, let's be real, the accelerating climate change has brought on further urgency to update the original version, which was published in 2019, then updated in fall 2021, and then a third update coming this fall 2022. We will also publish that updated version. Now, we are not saying that the roadmap will solve all of our healthcare problems and the public health crises that we see. It is a proposal. It's realistic, strategic, and approachable. We're not saying, fix this system now, you do it. We are saying, here's a proposal, let's fix the system together. Let's talk about this, let's move forward. So you'll find the link again for the 2021 roadmap in the chat. The next thing that I want to talk about is the CAPA's involvement in the Healthy California for All Commission. So in late 2020, Governor Newsom created his Healthy California for All Commission. The commission worked and developed a plan from January 2020 to May 2022, during the pandemic. And they met for virtually, obviously, for advancing progress toward achieving a healthcare delivery system that works for California in order to provide coverage and access through a unified financing system, including but not limited to a single payer financing system. In the chat, you will find the link to the governor's Healthy California for All Commission, and we refer to it as the commission. So the first commission meeting was in person in January. After that, they met virtually, and at every single meeting, CAPA leaders provided public comment about who we are, our advocacy, and our roadmap. And we encouraged commissioners to adopt parts of the roadmap or all of it, frankly. We put our proposal out there and we offered it. And we asked them to include it in their final report to the government. That was our main task, to write a report to the governor to see how California would get to where we are to a single payer system or unified financing. The commission then prepared this final report to the governor, and they submitted it to the legislature and to the governor himself this past May. And so when the commission revealed this final report, it was evident that CAPA's roadmap to Golden State Care had some impact in their conclusions. One of the members in the commission referred to our roadmap as one of the most comprehensible documents to achieving universal healthcare in California. And so what's going on with the report, you may be asking? Well, we know that when the governor announced his budget for the coming year, funds were allocated to help bring this report forward in terms of establishing offices that would improve the healthcare delivery system and that would control costs of healthcare and would just improve everything overall, taking us step by step. And we want to see it move forward. I'm talking about CAPA. And that's why you're here joining us today to connect with us, to build our movement, get loud, make demands, and work with California decision makers and leaders to ensure that this final report that the commission wrote takes its next steps toward unified financing. Then there is one more thing. So I'm done with talking about the commission, but now I'm transitioning over to coalition building. So some of you may or may not know this, but I just want to go ahead and define it. So what is a coalition? A coalition is an organization of diverse groups of interest that join their resources, human and material, to produce a specific change that they are unable to deliver as an independent individual organization or separate organization. And this is why our coalition building, CAPA's coalition building, is so important, because what we cannot achieve on our own, we are going to join forces with other organizations that are fighting toward the same thing. A coalition, as I said, is a group of individuals or organizations that are formed around a specific social issue. A coalition, organizations in the coalition work together, often temporarily, in a partnership to achieve a common goal. And the coalition needs to plan work, head up the coalition administratively on the steps that are to be taken to achieve a desired outcome. And a coalition discusses lessons learned that can inform future work. Effective coalitions harness existing resources, like I said, human and or material, to develop unique approaches that work for that coalition or for the issue. And CAPA engages in this coalition building with Health4All, one coalition, and Care4All. Our speakers today will talk about how their organizations, because they are the lead organizations of the coalitions I mentioned. And for our first speaker today, we have Iván Barragan. Iván Barragan is the policy coordinator and of health and public benefits at California Immigrant Policy Center. Here, they have offices throughout California, but Iván is in LA. And so I'd like to welcome you, Iván. Thank you so much for being here. And I've said this to you before, and I'll say it again here in front of our members. Thank you so much for leading this Health4All Coalition. You are such a great organizer, and we are excited and we look forward to learning from you. Can you tell us a little bit about your background and then move into talking about what you have prepared for us today?
Sure. And thank you, B, and thank you everybody for having me today. Iván Barragan, like B just said, use he, him pronouns. I was raised in LA, still live here in LA, call it home. I think I want to call it home for the rest of my life. Such a great place to be at. My background in health policy really starts after I graduated from undergrad in 2015. I was looking for a job, like any job that I could get somewhere in the medical field, somewhere public health related. Didn't really know what I wanted to do, but had a I was really involved, like, well, I say involved, but I meant like posting on Facebook about when the Affordable Care Act was being passed through Congress. I was always been into politics and health policy, just always felt into that. And so I managed to get a job as a health insurance navigator at Venice Family Clinic here in LA on the West Side. It's one of the, if not the large, I think now it is the largest free health clinic in the county. But so anyway, I got a job as a health insurance navigator, enroller. There's like a bunch of different names, but basically enrolling people into health insurance, whether that be Medi-Cal, Medicare, Covered California, or My Health LA. So that's the first time where I was like, cool, I'm implementing the Affordable Care Act. This is just a year into its implementation. So that was very exciting for me, just to enroll people into health insurance. And then it was actually there while I was at Venice Family Clinic when we had the first Health4All expansion to kids in 2016, when that went into effect. So that was very exciting too, just to see all those kids just flip over onto Medi-Cal. We can go into exactly how that goes later. But at first, that first rollout was very rocky, and the kids weren't actually transitioning onto full Medi-Cal right away. It took a couple of months of back and forth with DHCS and the local DPSS office, and LA County supervisors had to get involved to make sure that kids weren't being terminated from the My Health LA program, which is a health program for folks without any other health insurance. And so it was a lot of like advocacy for like the first 3 months, just to make sure that everybody was where they had to be. Which is actually my first like foray into like organizing and coalitions and all this stuff. And I actually found that very cool work to, go to the county board of supervisors and tell them, hey, this problem is happening. We need you all to step in, and please do not terminate these children from My Health LA until we have them onto the full Medi-Cal program. So that was my first again, foray into that space. And I thought that was actually pretty like, wow, cool. We lobbied them directly and they listened to us and we got something done. But then after that, I was sort of like still scratching my brain as to like how that whole thing happened. And I think I bugged my boss enough with questions at one point. She's like, you know what, Iván, you just need to go get a degree so that you can understand like how this whole thing came to be, and so that you can stop it from happening again. Quite literally. And I was like, sure, Karen, just write me a letter of rec and I'll be out of your hair and I'll go do my degree. So thankfully, she did write me a great letter of recommendation. And then after that, in 2017, I started my MPH studies at UCLA, and I did it in the Department of Health Policy and Management, where I graduated in 2019. So that's in a nutshell what drew me to like health insurance and immigrant rights. I should have mentioned, sorry, that Venice Family Clinic has still, I think, a lot of undocumented immigrants as patients. So it's free healthcare, right? So everybody can go there. But we did capture a lot of undocumented folks coming into our clinics. That's where I got my that intersection of health insurance coverage, public health and immigrants. And I carry that with me to this day here at CIPC. So that in a nutshell is what I've done and how I've got to be where I am. He briefly mentioned my role, but yeah, I am one of the co-leads or the organizing work for the Health4All Coalition. Our other co-chair is Health Access, Bryant. Hi, good to see you here today. He's at Health Access and he leads Care4All, so I'll let him talk about that. But Bryant and I work pretty closely on Health4All. So shout out to Bryant for always being a great supporter for Health4All as well. So what is Health4All? We kind of went over some of the basics already, but to recap, it's a statewide coalition dedicated to removing exclusions to healthcare on the basis of immigration status. It's been around for about 8 years, I think now at this point. B, you may actually know the actual timeline. I think it's been around since like 2013 or 14 or something like that. Going on 10 years for sure. This coalition is made up of about 180 organizations from our last count. And these are folks from all walks of life. I mean, public health practitioners, like CAPA, of course. We have some community-based organizations, direct services organizations who work with community members directly, student organizations like CAPSA, of course, and just policy advocates in general. There's, a bunch of policy advocates where our work sort of aligns when it comes to health equity and racial justice and immigrant rights. So basically anybody you can think of that could be involved in this probably is involved in Health4All. And this coalition really came about around 2010. We started thinking about these exclusions that still remain in our healthcare system. As great as the Affordable Care Act was, I think had some pretty glaring flaws that are just now being fixed. But first and foremost, I think was that it explicitly excluded folks without status from either the Medi-Cal expansion or then the subsequent exchanges to buy insurance that we call Covered California. And so we really saw like a need like here now to really do something with state dollars, right? And that wouldn't or shouldn't require too much federal intervention or approval to expand that safety net further to folks without status. And so naturally the Medi-Cal program came to mind, since that really only requires state dollars to cover folks that aren't covered under federal law. And so that was just where this came from. And so to date, I'm happy to report, like B said earlier today, that we have achieved Medi-Cal eligibility to all Californians under the age of 18. We got that it went into effect in 2016, signed into law the previous year. And to anybody under the age of 26 at the start of 2020, right before the pandemic, which is pretty great to see. And then over the past year, we've actually had a lot of moving pieces in the Health4All Coalition, a lot of good moving pieces, I might add. We got Health4All older adult expansions signed into law last July, and it went into effect this May 1st, like B mentioned, which is a pretty great achievement, right? We actually started last year asking for just 65 and up, but because of the rosy budget projections, we thought maybe we can push for a little bit more. And everybody was lockstep. Yes, let's go for more if we can do it. And so we, in the end, managed to get coverage for everybody over the age of 50, which at the time was projected to cover about 250,000 older adults. And this is solely based on the amount of people that were on the emergency Medi-Cal or restricted scope Medi-Cal program, as it's known, that only covers emergency services. And so the idea being May 1st, they just get all flipped over to full Medi-Cal, which thankfully since the day of Health4All Kids, these transitions have been like pretty much without hiccups. But actually we just found out last week that we now have 280,000 folks enrolled in the older expansion program, meaning 30,000 new folks that weren't previously in the Medi-Cal program enrolled since May 1st. So that's still pretty great. 30,000 people above baseline projections means that there is still definitely a need for health coverage out there. It's just tough to get some of these numbers because they're not in the Medi-Cal program. So it's tough to estimate how many new people will enroll. But I think folks were saying about 26,000 folks were expected to enroll. So we smashed that record for sure. We got 40,000 new people that actually ended up enrolling. But all due to the work of the Health4All Coalition, where we have a bunch, like I said, of direct services organizations and community-based organizations that do a lot of this outreach work. And so I want to say, that the Health4All Coalition really pulled through on this and got the word out and enrolled people, which is ultimately what we want. So then this June, literally the last day of June, June 30th, the governor signed into law, the big healthcare omnibus bill, with a bunch of goodies, but for Health4All, it contained a 26 to 49-year expansion. Tentatively going, well, not tentatively, it will go into effect no later than January 1st, 2024. And that is projected to cover at this point 750,000 people. So by and large, our biggest expansion that we've ever had, like literally three times as big as older adults. So we're very excited, when this does go into effect. By the end, it should roughly cover 1.3 million people, give or take a few folks who are, who may have status or who may have earned too much money to no longer be on the program. But give or take, that's about how many people should have been covered by these expansions over the past 8 years, which is still pretty big. Over 9 years, that's a big achievement. No other state has done this. We are seeing other states take our lead though, like Illinois, starting to do some of this, starting with older adults, they're moving down the ladder. We see folks in Connecticut with their Medicaid program. I think they call it Husky Care. So, we are definitely setting the example for the rest of the country, which is some responsibility that we don't take lightly. Like, we know that the eyes of the nation are on us. And so we try to do this work, as best as we can. And actually a couple of weeks ago, the Department of Healthcare Services actually let us know that they are going to implement a new policy for 2023, which is to just leave everybody on the Medi-Cal program on Medi-Cal for all of 2023. And the reason why that's important is because of the current, public health emergency. The continuous coverage for Medicaid programs has been in place since March, April of 2020, meaning folks shouldn't, some have, but folks should not be terminated from the Medi-Cal program. They should just remain on Medi-Cal. They should not be, oops, sorry, dropped my microphone. Getting too animated with my hands here. They should not, receive the redetermination or the renewal packets that are infamous. And so the idea was when the public health emergency comes to an end in January of next year, that whole process would start again. And young adults who had coverage because of the young adult expansion, because they are over the age of 26, should technically no longer be eligible, which is true, right? That's why we got the 26 to 49 expansion in there so that we can cover that gap. But our concern, and we brought this up many, many times to anybody and everybody who could listen, was that, hey, these young adults are going to be terminated from the program sooner or later, only to be deemed eligible again in 2024. So there's going to be like this period of uncertainty in 2023 in which they may or may not have Medi-Cal. And so finally, after much lobbying, they did listen, and they announced last week or 2 weeks ago that that is not going to happen, which is pretty great news. It means that 40,000 folks will remain on Medi-Cal throughout 2023, which is ultimately what we wanted. I mean, so that's where we are in terms of the Medi-Cal coverage. Of course, implementation is always very important for us. We always want to make sure that this is implemented in a right way. And so the Department of Healthcare Services is going to be convening a stakeholder work group for this new expansion to 26 to 49 on Tuesday. I'm proud to say that CIPC will be co-chairing that work group for the first time. So that's very exciting. It's a work group just convened by the Department of Healthcare Services to provide feedback to them from the community or, or stakeholders on notices of actions, for instance, letters that are sent out, but also hold them to account, like to give us a timeline of when this whole thing is going to play out. We understand 750,000 people is not a small number, but by far the biggest expansion. So it's going to take some time to identify everybody and, put them onto the right Medi-Cal aid code, which and so anyway, it'll be an amazing endeavor for over the next year and a half that this work group meets, and of course we're going to hold them to account for the young adult protections that they're going to be implementing as well. So that in a nutshell is Health4All. I know I'm coming up right on 15 minutes. Looking to the future, since we do know that there are still some folks without status who earn just a little bit over the income limit to qualify for Medi-Cal, right? And that, of course, we've been, cognizant of that. And way back in the day, B, you might remember, way back with the Health4All Kids campaign in 2015, we actually had a two-track solution to that. We had the Medi-Cal expansion piece to this, and then we also had a bill, a waiver, however you want to call it, to open up covered California to folks without status who earn too much money for, to qualify for Medi-Cal. And so we're going to be looking at that again this year, maybe, potentially. We have to meet with folks from just in the legislature to see what their thoughts are on it, and we have to strategize on policy. But the idea is next year, our campaign that we're internally calling Health4All 2.0, 1.0 being the Medi-Cal piece. But the idea is that we're going to maybe try to push the legislature to open up covered California to folks without status. And that's going to require a whole bunch of different policy pieces that we're a little bit rusty on, because it requires, permission from the federal government in the form of a waiver that I don't want to bore you all with the details because it's very complicated. But anyway, that's what's in store for Health4All over the next couple of months. Rest assured, if you're on our listserv, you will be, or you can always talk to B if you want any updates directly from her. We will be updating the coalition, probably some educational pieces, because this whole, covered California thing is very complicated, even for us. And so stay tuned for that. Of course, we'll have actions for next year. If you've been involved with Health4All, you've seen our social media actions that we've had, because of the pandemic, we really haven't had a chance to have like in-person actions, but we probably suspect that the lobby visits will be coming back this year to meet with legislators to shore up their support. Medi-Cal is like baked in, like everybody supports it. Covered California piece is a whole different thing. If you've been involved with the whole Covered California saga with the subsidies and the cost sharing thing, you know how much of a of a hard battle that is. So we don't expect that to be any easier next year. But if you can join us for any of our lobby visits or any of our actions, for sure we will love and appreciate the help to get us to Health4All. So anyway, I'll leave it at that, since we are at time, but I'll take it back to you, B, unless we have Q&A. I don't know if that was part of it or not, but take it away.
Yeah. Thank you so much, Iván, for all these great updates. And again, for all the work that you do. We have so much to learn from you, and thank you for sharing your story. It's very inspiring. And so we can actually, have one or two questions from members. If you have any questions, go to the bottom of your screen, go to that reactions happy face and raise your hand like this, and we'll call on you. I'm going to lower my hand now. If you'd like to drop the questions in the chat, then one of our staff members will have those questions ready so that we can go over them in the future. And if Iván's time permits, to answer them. And I do see one, which is Dr. Arnie Gass. If I do miss them, please, I'm going to need Dr. Stevens' support also with this, looking out for those hands. Okay.
Mm-hmm.
Okay, so my name's Arnold Gass. I'm a CAPA member, and my main function in San Diego is working with CAPSA, trying to build a chapter here at the University of California and the University of California School of Medicine and the Pharmacy School. So the question I have, Mr. Barragan, what sort of reception do you get when you go to Sacramento or to talk to people? Where are the resistances and where are the supports?
That's an excellent question. For Health4All, definitely, I think over the past couple of years, we've, gotten a sort of reputation, like we've come to be known as the coalition, right? That stands for healthcare coverage to immigrants. And I want to say over the past couple of years, the resistance has sort of subsided. Like, if anything, it's only increased the support for Health4All. Like I said, actually last year when we started with the older adult expansion, we started actually just for seniors 65. But we got word from the assembly budget that there was actually a lot of money. And so the idea of going for more than 65 actually came from one of our champions in the assembly, Dr. Joaquin Arambula. I should have mentioned our champions. I'm sorry, I forgot. We need champions at the Senate and the assembly. But he was hearing from Assemblymember Phil Ting, who's head of budget or appropriations, I always forget which one. But he's like, hey, he told me actually that there's a lot more money that we can use to go for more than just 65. And so we're like, great, let's go with that and run with it. So I'd say over the past couple of years that like, yeah, there's almost universal support for it. We didn't have many people that we needed to pressure this year. There's always some like sort of resistance from folks in the Central Valley. Like we were actually at the start of last year sort of apprehensive, like we might need to shore up some support from this person or that person in the Central Valley. But actually in the end, everybody voted in support for it. That I don't think maybe in the previous year in 2020, there was like 1 or 2 assembly members or senators that like abstained from it. They didn't vote no on it. So I don't think we have had any Democrats vote no on the Health4All proposals so far. But yeah, for by and large, I'd say we're like, everybody knows us, they support us. And then this year, I think more proof of that was with the governor's announcement of the 26 to 49 expansion in one fell swoop. We were not expecting that. Everything that we had been hearing, whispers was that he was going to split this group in some way. We weren't exactly sure where that cleaver was going to land. We were preparing for, I don't know, 26 to 35 or something like that. But lo and behold, he's like, no, we're doing it all for everybody. 2024, which is a great surprise, no doubt. But then everybody in the Assembly and the Senate put in their budget proposals throughout. So there was never any wavering from the entire, expansion, which was like, okay, cool, people do support us. So we don't really have any, there were a couple of whispers of people here and there saying we might have to cut the group down, but in the end, everybody stuck to their guns and it got through. So I want to say we have that universal recognition as being the coalition for healthcare coverage for immigrants. No support for Republicans, Bob, unfortunately, but because Democrats have a supermajority, that wasn't really an issue. But maybe what we do anticipate next year is a new learning curve. There are about I think a third of the Assembly and the Senate are new members, right? Elections, retirements. So a third of the legislature will be new. So that's something that we're going to have to keep an eye on. A lot of education for those members that probably have never heard of Health4All. I don't know. I hope that they have. I want to say that we're known statewide, but it's going to require new education for new members to get them on board with everything that we've done. And then, sort of try to see the support for what's to come for, Health4All 2.0. And so maybe the Covered California piece will definitely, I think, be a hurdle that we're going to have to get through. Like I said, if you've been flying the Covered California cost sharing drama, right, it's tough enough to get them to dedicate, dollars for cost sharing into Covered California. And so to get them to help us with opening it to undocumented immigrants might be a new battle that we're going to have to wage. But we'll cross that bridge when we get there. We don't really know who's in support of that or who even really understands Covered California. It's a complicated mess just to get your head around that in and of itself. And so, like I said, stay tuned. If we have, there will for sure be lobby visits. I can assure you of that, to gather support for this new piece. And so, if you're involved with us and you want to join our lobby visits, we will absolutely more than welcome you to put the pressure on these folks, to get us to Health4All. But thank you for that question, Dr. Gass.
Yeah. Thank you, Iván. And for all of our members here, that CAPA is not alone. We have partners throughout the state. We have coalition partners. We'll participate together. It's about doing it together, joining forces. And so you'll hear from us. We'll connect you to legislators and to Iván, of course, and our Care4All partners as well. We'll move on to the next speaker. If you have any questions, feel free to drop them in the chat. We'll keep a record of all these questions and get back to you. Dr. Jim Kratzer, we would love to see your shirt. Can you show us what you're wearing today? So yes, so we have one person wearing the t-shirt. And okay, great, excellent. Thank you for showing that spirit. Next, we'll move on to our next speaker, which is Bryant Mirantontes. Bryant Mirantontes is Senior Community Organizer with Health Access California. And Health Access is one of the most influential statewide organizations in California that advocates for the healthcare rights of consumers. And I will go ahead and just Yeah, welcome you, Bryant. And can you tell us a little bit about yourself? In lieu of me reading a bio, we would love to hear from you and then hear what you have prepared for us today.
Absolutely. Good morning, everyone. Thanks for the introduction, B. Can folks hear me clearly and see me? Great. A little bit about me. As B mentioned, I'm with Health Access California. My pronouns are he, him. I'm a senior campaign organizer with Health Access. I've been with Health Access for coming up on 3 years now. Before Health Access, I was working for a small nonprofit in Orange County that I worked on 2 local policies to mitigate health disparities that are tobacco related for youth and young adults in the cities of Santa Ana and San Diego. And that really got me into the social justice work around health justice and health outcomes and equity in our system. And so that kind of got me in a more formal way to get into policy work and help uplift the voices of communities and folks who are impacted by a variety of issues. And so I started with Health Access, as I mentioned, about 3 years ago, and I've slowly been able to grow and develop within the organization and lead a variety of campaigns to really help us get towards a more just, more accessible, affordable, equitable, cost-contained healthcare system in California. So I do have a couple of slides that I have prepared for you all today. B, would you please enable screen sharing for me? Again, thank you all for inviting me to speak today. I have a lot of—
we will do that in a minute, Bryant.
I have a lot of really important, exciting news to share, with also opportunities to take action. I think what folks can usually, when folks are receiving emails from me, it's usually associated with opportunities to engage on a variety of issues. So I will speak to some of those in just a moment. All right, can everybody see my screen? I can't see your— okay.
Yes.
So as I mentioned, I'm with an organization called Health Access California, and I'm here to provide a health access update specifically around some federal legislation that's been passed and how that's related to some of our statewide work. And if you have any questions, please feel free to throw those in the chat. And I'm not able to see the chat, so if somebody can just like unmute to let me know there's a question, that would be completely appreciated. And I'll get started. So a little bit about Health Access. For over 30 years, and actually we're coming up on our 35th year anniversary in the next couple of months. Health Access has been the lead healthcare consumer advocacy coalition in California. What we do is we advocate for quality, affordable healthcare for all Californians. And so some components of our mission is preserving access to care and expanding access to care, protecting consumers through a variety of reforms, and expanding coverage and winning comprehensive health reform at the state and federal level. As I mentioned, we are at the top, we are a coalition organization, which means that we generally rely and depend on our partners, whether they be small grassroots organizations or large statewide organizations or even nationwide organizations, to really advance a variety of reforms in California. We don't have our own grassroots. We do have a small member list, which I'll speak to at the end of the presentation. But what we do is we really help provide resources and act as a liaison between what's happening on the policy end and connecting that to our partners to really streamline engagement and participation, and really help put a human face and show the human impact of the legislation that's being worked on in the Capitol. And I'll speak to one of the coalitions that we lead with a variety of our partners who are, I'll speak to actually now, is the Care4All California Coalition. So the Care4All California Coalition, the goal is to get us to a universal healthcare system that's equitable, affordable, and accessible, and of quality for all Californians, regardless of immigration or documentation status. And we have a steering committee that we partner with very closely to help kind of lead the campaign. That includes also CAPA, California Physicians Alliance, in addition to California Immigrant Policy Center, who's on this call, and a couple of other partners, including some folks from labor, folks who represent the millennial voice, and other voices to really help ensure that a variety of groups are represented and have a seat at the table when key decisions are made for the campaign. But among those, there are about 70 organizations that are also on the coalition, which you'll see many of them listed here. And we work on a variety of issues at the state level to, again, get us towards a universal healthcare system. And I'll just flag that when we talk about a universal healthcare system, we look at getting towards a universal healthcare system and getting towards single payer as issues that aren't necessarily working against each other, but are more complementary. And we see that there are a variety of reforms that we can make now to really help us achieve a system that is first able to get folks covered and implement and pass a variety of offices and agencies and tools to ensure that we can potentially implement a single payer system in the future. So we look at it as doing what we need to do now while also saying, yes, we can do more. So there are a variety of kind of issue areas we work on, including covering all Californians and improving affordability towards universal coverage. And when we talk about access to care, as I'm sure many of the folks on this meeting are well aware of, we talk about that closely related with affordability. So when we talk about making healthcare more affordable, we talk about how that's related to improving access to care. If folks can't afford their healthcare, they're not going to be able to access it. Or if they have health coverage and it's too expensive to actually meet their deductible or the copays are too high, that's still an access issue. So we do a lot of work to really help address those gaps. In addition to the second point there on improving healthcare equity in our healthcare system, reducing health disparities, improving health outcomes, especially for folks who are disproportionately impacted by racism within our healthcare system or a lack of language access, among other issues, while also including quality and transparency. And then the last issue area, which is probably the most I guess, contentious of the issues is in containing healthcare costs and ensuring industry accountability. And the reason I say this is a contentious issue is because we usually have a lot of opposition from during that area. And that's actually kind of where most of my work lies, which is kind of exciting when we're able to really regulate the healthcare system and make healthcare costs more affordable for folks as they continue to skyrocket unchecked. So those are kind of the broader bucket areas. I did want to flag that for you all before I go into some updates on the Inflation Reduction Act to help just contextualize the work for some points that'll be made later on in the presentation. If there are any, let me see if there's any questions.
Yes, quickly, Bryant, just a question, and I don't remember, is CPCA, the California Primary Care Association, part of Care4All? Can you remind me?
Yes, they are, and it
great.
is the California Health Plus Advocates is that.
Oh, got it.
Yeah, they
Thank you.
are. Yeah. All right. Thank you for your question. And please keep them coming if you have any. I'm sorry, I did not see that one. So if anything else, please feel free to unmute and interrupt me. I'm happy to pause. But just to talk about some of our campaign accomplishments, just high level, improving affordability in covered California Medi-Cal by making premiums more affordable and doing more work to eliminate premiums in Medi-Cal, eliminate cost of sharing in Medi-Cal, while also expanding Medi-Cal, which Iván Barragan had mentioned earlier, with the work around Health4All, which is one of the issues that is a priority within the broader Care4All campaign, but it does have its own coalition among which many of these other issues actually do have their own separate coalitions as issue-based coalitions. In addition to expanding Medi-Cal, which I'll just flag another success that we saw this year, as far as being implemented this year, was a repeal of the Medi-Cal assets test, which was huge, which disproportionately impacted seniors over the age of 65 and individuals living with disabilities where an individual, pretty much if they had over $2,000 worth of assets, they no longer qualified for Medi-Cal. So what this did was it actually kept folks in poverty because folks actually had to sell a lot of their assets and get rid of them to ensure that they maintained their health coverage. So we were excited to see that implemented on July 1st this year. In addition to increasing Medi-Cal eligibility, lowering maternal mortality rates, ensuring that we're addressing prescription drug costs and containing healthcare costs, which we saw some successes with this year as well on passing what was called an Office of Healthcare Affordability, which we're going to talk about implementing in the next several months to year. Let me check the chat, see if there's any questions. So can you please say more about the question? Yeah, so I can touch a bit about it. So the coalition has done a lot to, with our partners, specifically with the Western Center on Law and Poverty, in addition to a few other organizations like the organization called Black Women for Wellness, among others within the coalition. And we have a variety of issues that we've worked on, actually most recently, which was a bill called SB 65 by Senator Skinner. And that was called the California Omnibus Bill, which included a variety of, the reason they call it an omnibus is, as for folks who are unfamiliar, an omnibus is a broader package of bills wrapped up into one bill. So it's a bunch of policies included into one. And this included a variety of policies to reduce and mitigate infant and maternal mortality and morbidity rates by a variety of pieces of legislation. One of them being ensuring that Medi-Cal funds doula coverage, ensuring that the maternal mortality review board is strengthened. There is another midwife board, in addition to, it had so many issues in it. I can't believe I'm now forgetting. Let me find. But the goal is to ensure reforms at the state level, in addition to help mitigate those disparities. One of them was a bill that I didn't work on, given that I wasn't with the organization when it passed, but there was a bill that required certain physicians and healthcare providers to go through cultural competency training and specific trainings related to maternal mortality rates and deaths. And so definitely something that was a bill that definitely with the goal of lowering and addressing maternal mortality rates. And to your point, Susie, one thing that we've definitely shared, or at least been aligned with our partners, is like these issues are definitely not silver bullets. And so definitely like lowering maternal mortality rates is at least the goal, but I definitely see what you mean as far as like if that was quantifiable or if that's something that's been done, because all this work, we can pass this legislation, but an understanding of whether or not it's going to have an impact is still, the jury's still out. But definitely agree with you there on that one. If you have any questions about any of the maternal mortality issues, be more than happy to connect you with our partners. All right, so moving on to the Inflation Reduction Act of 2022. This is a bill that was passed by Senate Democrats, in addition to members of Democrats in the House, signed by President Biden, which was actually signed within the past, 4 weeks, with the goal to really lower costs for everyday Americans, while leading to lower prescription drug costs, lower healthcare costs, and lower energy costs. I'm going to focus on the healthcare pieces of this, just for folks who are interested. I don't have a whole lot of information on the issues related to climate, which I'm sure you can find. There are a couple of fact sheets that can expand on that. But I'll start with the lowering of prescription drug costs. So with the passage of this bill through the process known as reconciliation, now since President Biden didn't sign it, now Medicare will be empowered to negotiate drug prices for among its top most expensive drugs. I believe that will actually start in 2026 through 2029 and so on. starting with 10 drugs, going up to 15 to 20 drugs in Medicare Part B and D. I'm unsure of exactly what those drugs will be, given that they're still being identified, I believe. Also capping Medicare beneficiaries out-of-pocket costs at $2,000 per year. That's a huge deal, especially for folks living with MS who spend about $6,000 per year on drugs through Medicare Part D. This will save folks about $4,000 per year on average. And it's a huge deal. This is the difference between somebody keeping a roof on their head and being able to put food on the table, and having to choose between rationing or skipping their medication altogether. So definitely excited to see that. And also, I know folks will be able to pay that $2,000 per year. And instead of a lump sum, they could pay it monthly, so that you can split it up into 12 payments as well. But I know, given this passage, Medicare will no longer be spending more than $2,000 per person on drugs, and the individual and the enrollee will not be required to do so either. Also, another issue is penalizing drug companies for price hikes that exceed inflation, and that actually goes into effect next year, and that'll require drug companies to actually pay a rebate if those drug prices exceed from inflation, which specifically within Medicare. And so the goal is to ensure that as the prices have been artificially increasing and rising, making them less affordable for folks, the goal is to ensure that that no longer happens and that it aligns with how fast inflation is rising. Another issue is covering all vaccines for seniors under Medicare, which is definitely a big deal to get folks vaccinated and act as a protectant, and also ensure that folks have access to the care that they need. While also, the last one is capping Medicare beneficiaries out-of-pocket costs for insulin at $35 per month. And definitely, as folks know, insulin can be hundreds of dollars per month. And so the goal, so this is a huge deal, especially for all the Medicare beneficiaries who do get insulin through Medicare Part D. So I did cover just like a bunch of like the prescription drug pieces within this, but I do want to talk about the California impacts of this. So in California, just to show how many folks it is estimated to impact through this legislation, 114,000, about 115,000 seniors with Medicare would directly benefit from the $2,000 out-of-pocket cap. So this means folks who are paying over $2,000 per year for their medication who would already directly benefit. But also on the second line here, with the same legislation that's been passed within that, 5.1 million individuals with Medicare Part D in California will be protected from potentially having to pay more than $2,000 just to, and so what I'm trying to say is this actually covers everybody with Part D, and whether or not they would have to rely on this now or in the future, it's definitely something that's serving as a protectant and to giving folks peace of mind so it can actually help them plan and not have to deal with having to pay their mortgage or having to pay for some medication that they didn't realize they're going to have to start taking once they're diagnosed with any other issue. Another item is 333,000 folks with Medicare in California used insulin in 2020 alone. And so just to like reiterate, at that $35 a month cap, this will definitely save folks on Medicare hundreds of dollars per year, if not more, ensuring that they're able to access insulin for only $35 per month. And for the last part, I'll just add is 462,000 folks or enrollees in Medicare received a Part D vaccine in 2020. So eliminating the cost of that for folks and making them free is something that will definitely impact more and more seniors. Any questions on the prescription? Oh, so the question on why is there a need to delay the implementation of drug price controls? I honestly, this is something we've been asking for a while, and it doesn't make sense for it doesn't make sense for me policy wise, and it doesn't make sense for anybody politically for this to start going into effect in 4 years. So I couldn't tell you why. I've heard it was just some planning and internal bureaucratic issue on getting the Medicare drugs negotiated and preparing for them. But as far as the things that are going into effect in 2023, the drug rebates, so that would go into effect next year. The limit of insulin copays will go into effect next year. And also the vaccines will go into effect next year. In addition to, I believe at 2025 is when the out-of-pocket costs will be capped at $2,000, but that'll start to be phased in 2024, I believe. And yes, so definitely, yeah, so it'll cover the 10 most expensive drugs starting in 2026 as far as the negotiations are concerned, and but it'll actually increase to 20 in 2029. So it'll slowly go from 10 to 15 to 20. And I can actually, if you would all like, I can post a Kaiser Family Foundation analysis of this in the chat if you'd like to learn more. So in addition to that, a big piece that we've been advocating for as well as an organization and with our partners is lowering insurance premiums. So in 2021, the American Rescue Plan Act, that was another reconciliation package with the goal of kind of getting us back and in a more robust response from the pandemic and ensuring that folks had the support that they needed, and different states and local governments had funding they needed to ensure that they were able to also respond to the pandemic. And that passed in 2021. And one of the policies within that omnibus bill was to cap the amount that individuals who receive health coverage through the individual marketplaces that were established under the Affordable Care Act. It would cap their premiums at 8.5% of income, where before it was upwards of about 16% of income, I believe, which is just, you know, for folks who are, that's thousands of dollars per year that folks were expected to pay on their premiums. So we have been working to ensure that those premiums were, that premium support was extended, because without the Inflation Reduction Act, the premiums assistance was actually set to expire at the end of this year, which means that folks' premiums would actually increase by about $1,000 on average per individual per year. So thankfully, there was an extension on this within this Inflation Reduction Act by continuing to cap the premiums at 8.5% of income and going even further for folks with lower income, while extending them for 3 more years until the end of 2025. So this is a big deal for families. Again, on average, it's about $1,000 per individual who have covered California coverage. So it's going to really ensure that folks are able to continue paying for food and be able to put that food towards other household necessities. And another big component I wanted to just flag right here is the impact on Californians is over 1.6 million folks will save about $1,000 on average on covered California premiums, at least through 2025. And also, this does have continued support for over 407,000 small business owners and self-employed adults who do get their care through Covered California. And in addition to that, with this continued subsidy support, over 360,000 more Californians are projected by, I believe it's Kaiser Family Foundation, to have health coverage next year because of this continued support. So really, this is a huge deal. This is actually getting folks covered. Health coverage is, of course, related to health outcomes and just ensuring folks are getting the care and preventative care that they need. So we're definitely happy to see and excited to see these subsidies extended. If there are no questions or comments on this one, now that you've seen kind of the federal impacts on California and what it means for everyday folks in California, I did want to talk about more support that we're working on. I'll just point to this piece of data that 52% of Californians report skipping care because of cost. And this is research done by the California Healthcare Foundation, I believe. And if you'd like to learn more about that report, I can send it to you. They do polling, as I'm sure folks are familiar, every year on different attitudes, perceptions towards healthcare costs and access to care. And they usually release a new report at least every 2 years, I believe. So more support for Californians. So while we're talking about the premium support, a lot of folks, when they actually have health coverage, they are afraid to actually use it. While they're paying their premiums, they'll have deductibles that are up to $6,300 in Covered California, anywhere between $900 to $6,300, depending on their income level. And with that, folks are afraid to actually go see the doctor or go get any operations done or any procedures done, or get any medically necessary medications, or go see the doctor because of high deductibles or the high copays that they still have to pay. So one of the issues that we've been working on is a bill to eliminate deductibles and reduce copays for almost 1.5 million individuals with silver plans in Covered California. And that bill actually successfully passed the legislature, and it now sits on the governor's desk. And really, this is something we're aiming to get signed in the next within the next couple of weeks. There's definitely been some pushback from the administration, but we're definitely counting on the support from our partners, and definitely I know CAPA has been tweeting and helping with a couple of actions and rapid responses that we've been working on, so we do appreciate it. But we do see this as a big issue related to access to care, and also folks not having to break the bank or go deep into their savings for having a medically necessary procedure in a hospital. So now that I said all that, there's a variety of ways that everybody here can help and join us in the campaign. One opportunity that everybody, definitely any individual can take or engage in is calling the governor, urging him to sign SB 944. I put a link to our new mode page in the chat, which it's pretty much all you need to do is input your information, you review the script, and it connects you with the governor's office. And you can share, use your voice to really share about why this is so important for either the patients you work with or for you as an individual as well, and really highlight just the human impact of what it would mean to ensure that deductibles are eliminated and copays are reduced for so many enrollees, just to make sure we're improving access to care, and especially with the funding that we do have for it. Another item is attending in-district legislative visits, something that's been really helpful in the past. I know some of our partners are here as well. In addition to that, gathering personal stories, that's always a huge component. That's always very helpful. If we're able to identify any stories from patients related to health coverage or related to not being able to afford care, among any other issues, we definitely are always looking for those to really uplift those in our work, while also joining our membership list, which is also very helpful to receive regular updates and opportunities to take action. And if you do make that call, you'll automatically be added to our membership list, just for folks who are aware. But other than that, I think that covers it for me. Thank you all for listening to me talk for the past, I hope, not too long. I'm happy to take any questions.
Thank you so much, Bryant. What we will do is we will add whatever other questions people add in the chat. We'll add them to a document. We'll send them to you. We're happy to connect you with our members as well. So if any of you have questions, feel free to email us. Our info email will be posted in the chat. Bethlehem will do that. And thank you so much for being here again, Bryant. We'll connect soon, and we hope that you have a great weekend.
Thank you, and thank you all for having me. And Dr. Gass, I can maybe follow up with you if he follows up with that question. And that would be super helpful.
Yeah, thank you very much.
Have a good one, everyone.
Thank you so much, Bryant, and thank you, B. I want to personally thank Iván and Bryant, just because they have been so supportive in my role as CAPSA coordinator. They have both connected with me one-on-one, and they both have presented to our CAPSA interns these last 2 summers. So you all have great wisdom, and I'm really glad that we're partners, and you're able to really teach our students some of the basics. So thank you so much. And so I will quickly go over some of the CAPSA updates. So I want to start off, I have 5 main points that I would like to cover. The first one being Project White Coat. So this, for Project White Coat, we have about minimum 10 students per chapter that enroll to become CECs. So they are able to gain that knowledge of what health insurance looks like, how to get coverage, and they're able to enroll community members. So our students really enjoy doing this work, and they like to really gain that knowledge because, as we all know, health insurance is a little tricky. So we will continue to work with Project White Coat and improve it this coming school year. I also wanted to briefly mention that we started a CAPSA board. So we currently have 5 active chapters. So we have UCI, UCR, UCLA, UC Berkeley, and UC Davis School of Medicine. So this was a project that was brought to our attention by the UC Berkeley chapter. They did a great job in creating a proposal and bringing it to me and Beatriz. And we discussed it, we made a few edits, and we are now having our 3rd meeting this month. So it's really great to see all of the different chapters throughout California come together in this space, really share their needs for their personal, respective chapters, but also we will be working together collaboratively to plan the Activate You conference, which is set to be held in November. So it's really exciting to work with these leaders, these student leaders. Thirdly, I'd like to mention our summer internship, which has happened now for two summers in a row. That started back in 2021, and it has been great. We have had a total of 13 students in the past 2 years. It's all been a virtual setting, and we've gotten really great feedback. I'm pleased to say, I believe Min, if you're still here, thank you for joining us. He was one of our first interns, and it's just great to get the feedback that I've received, that students that go through the internship, which is 4 weeks, they have heard from our partners, Iván and Bryant, but they also just feel like they feel more comfortable asking questions or seeking, education in terms of health policy and advocacy. And so it's been really great. And I hope that it is a program that continues for summers to come. So next, I would like to briefly mention that we started our first official mentorship program with the UC Davis School of Medicine group, and then CAPSA undergrad chapters. So we had a total of 4 students be paired with 4 med students. And so it's been great. We had our first a meet and greet. So the mentees met their mentors, and it was really nice to just have them, feel like motivated to wow, I can become, like I could be in this space where I can become a med student and then, continue to pursue my career. So it's been really nice to see that play out. And we hope that in the near future, we will have more med schools join us and form their CAPSA chapters to then also have those students become mentors to other undergraduate students. Lastly, I just want to mention some future plans that we'd have moving forward. We do plan to expand to community colleges this year. Beatriz and I will work very closely in developing a minimum of 2 community college chapters, but we do hope that more start to develop throughout the year. I do have some exciting news. We do plan on starting a UC Riverside Med School chapter. Nimra had to hop off, but she has been a CAPSA supporter, volunteer, and she is currently CAPSA rep on the CAPA board. And so she's done great work for the organization and with the organization. And so now that she's entered med school, she hopes to start a chapter there. And so we're really looking forward to working with her and making that chapter come to life, and then also get her classmates and friends to help support other undergraduate students from other CAPSA chapters. So those are a few of my updates. I am glad to answer any questions. I know B will put my email in the chat. So thank you all for joining us, and yeah, thank you.
Great. Thank you, Yessie. Yes. Thank you. We love to hear about what our student organization is doing, and we want to know how to support you even further. Our website for CAPSA is going to be coming up next month. Yessie and I have been working on this. We'll have a launch party to show this website, and you'll all be invited, of course. In a subsequent email after this call, we will share the CAPA programs that you can all get involved with. We also have links that we will share in there. So all of the information, you don't have to write it down or be clicking everywhere. You'll get that on a separate email. But just to save time, because we want to hear from you, I will just move on to say that for our Medicare anniversary event that just took place on July 30th, which hopefully everybody on this call was there. Probably you were, but maybe we have some new folks here. For that annual fundraiser, which is our biggest fundraiser of the year, we raised $23,000. And so I want to thank you so much for all of your time and donations, and for being there, and for watching, and everything that you do to ensure that this organization exists. With those funds, we will ensure that we take care of our staff. Right? We have 4 full-time staff that puts all of this together. And so we need to retain them, to organize all of you, to bring in new members and keep on turning the wheels, right? To build that momentum and get louder and build that movement and join forces, join coalitions, and we'll do this together. So thank you for that. That was our event. Please be on the lookout for other events we'll be communicating with through our blast, and we'll let you know how to get involved. Lastly, I just wanted to share with you that I am excited that CAPA is actually making 2 major upgrades. One of them has been completed, is an online fundraising platform to help our infrastructure, to help us organize, bring in new members, retain our donors, and to communicate more efficiently with you. The second one is in the process. That is a platform to organize our constituents, meaning all of you, all of our members. That is to communicate more efficiently, as I said, and also to organize as far as figuring out what legislative district you belong to based on the zip code that you have shared with us, so that we can connect you with our legislators, with your legislators, and connect you to the right people that are also doing other organizing out of the scope of CAPA, if you want to get involved in that way. Again, there are going to be issues on healthcare. So our staff has been putting all of this together. We need your support. Thank you so much. And I will just turn it over to Dr. Hillary Siebitz. Thank you.
You're muted, Dr. Stevens.
It's been great hearing from everybody and learning from our speakers. And now we're going to turn to our core of CAPA members and hear from them. And what we'd like to hear is why do you participate in CAPA, and what personal actions towards universal healthcare coverage have been satisfying for you? And if possible, keep the comments short. We have several people lined up, and we'll start with you, Daniel. Go for it. Unmute and go for it.
Good morning, everyone. My name is Daniel Lichtenstein-Boris. I'm a researcher with Acute Communicable Disease Control in LA County Department of Public Health, working on COVID-19. I first got involved with California Health Professional Student Alliance about a decade ago when Obamacare was first being discussed, and got involved with CAPA then. I continue to try to speak out about healthcare access and the need for infection control for COVID-19 and a strong public health system in California and the country. And I have a little blog, thewordaliveandactive.com, and I continue to post things every few months. And it's really satisfying to me to be part of an organization that supports universal coverage for all and for health access for all. Thank you.
Thanks loads. Thanks for being part of us. And now, Dr. Connie Casillas. I'm so sorry. Connie?
Hi, good morning, everyone. Thank you for having me. Yeah, I came to CAPA not too long ago. I was invited by one of my colleagues, Dr. Hector Flores, to a meeting probably a little bit over a year or so ago. And I was, introduced to the community. And I think, one of the reasons that I joined and I'm now a part of the policy committee and just as of late, recently, and I enjoy being on that committee, is because of the, the advocacy, obviously, and the community of advocacy and all of the knowledge and learning that I've gained from just being a part of this community. So I really appreciate that as a, as a full-time clinician. Sometimes it's difficult to, I think as physicians, we are advocates, but as physicians, it's also difficult to find the time, during our work days to get involved in the type of advocacy that CAPA does so well. And so I think, being a part of this grassroots movement is really empowering, as a physician, to be able to know that, I am working, towards improving access to care through universal health coverage with CAPA. And the other reason I think I joined is also to help grow the awareness amongst the students that I work with as a part of another nonprofit called Alliance and Mentorship, which is a mentoring organization for underrepresented in medicine students who are pursuing health professions, who really, desire the knowledge that your organization provides around how to best support, vulnerable populations, which is who, these students want to serve. And so building, sort of partnerships and alliances with CAPA around, helping to train the future generations, and what CAPA is doing such a great job of with their, with the student efforts and with, Yesenia's and Beatrice's efforts. Yesenia has also been on the MIMENTOR board as well. And so that synergy is really empowering for me as a part of the board of the other organization. And I really look forward to working further with CAPA in the future. So thank you for having me. I really appreciate being a part of this community.
And can you explain, is today, Dr. Casillas, is today National Latino Physician?
So I'm wearing this shirt, and I'll try to turn around and show you the back. I don't know if you can see. It says,
right.
Necesitamos más. And this is a movement that two of my colleagues on the Alliance and Mentorship AIM board, MIMENTOR board, started. This is our inaugural year, and you can go to the website. It's the National, Latino/A Physicians Day, and you can help support the movement. The funds go towards actually the MIMENTOR student run organization for mentoring the students. And it was really started to raise awareness of the disparity. So we have, a fivefold or more disparity in the workforce for physicians and also for other healthcare professionals in this state. And, there's a threefold disparity for Latinx, physicians in the country. So it, it's really started to build awareness around that. And that's really what, my part of my advocacy also is working towards. Increasing access through universal coverage is definitely a personal goal for me, but but also increasing the workforce, diversity so that the workforce mirrors the population, which I think is what it should do. And I'm sure you all agree. And so working towards that as well is part of what I do. So if you want to go support, just go to the website and you can look it up.
And since we have time, and after we hear from you, we'll hear from Dr. Keon Mitchell and then anyone else. What started you on this path to become a doctor? As a little girl, did something happen, or just a little of your background that got you to doing this kind of work?
So, I think I came to medicine, with a kind of a passion for kind of advocacy for the communities that are more vulnerable. I grew up in, a predominantly Latinx community in, eastern part of Los Angeles. My family is actually from Texas. They're Tejanos. So my grandmother was from Jalisco, Mexico, as were some of my father's side of the family. So we're, we were Chicanos or Mexicano, Americanos were, Tejanos really. But I was raised here in Los Angeles, and I'm, very grateful for the emphasis that my parents put on education for me, and for working in the community. And so I, went into college really thinking I was going to pursue social work, social medicine, and I did work a lot with drug abuse and addiction education in college. But I also, probably like a lot of the physicians here, loved science and pursued research, and ultimately decided I would go to do the clinical route and work with patients one-on-one, which I love. And, it's been a really gratifying career thus far. But, as just over time, you see all of the, inequities amongst the populations of patients you care for, coming in and out of, being insured, not being able to, provide for their families, and healthcare really takes a backseat when you're struggling to make ends meet and care for your families, and for everyone across the board, both genders. I have a lot of women patients, obviously as a female physician, and so I see the struggles that women have, in particular, trying to care for their families and make ends meet that way with multiple jobs. So I think that for me, things came full circle in terms of my interests in really being an advocate and supporting patients entire needs, holistically. I'm a family doctor, actually. So, and then also trying to, in my off time, be a volunteer to advocate for, equity, not just in the workforce, equity in healthcare, and also, political advocacy. And, being inside an institution, I do work for Kaiser Permanente. There's, competing priorities always within any institutions. And so, I think I feel much more free and open and supported in a community such as CAPA and other nonprofits that can really be free to advocate without those, without competing priorities.
Wow, thank you. Thank you so much.
Thank you.
Now we'd like to hear from Dr. Keon Mitchell.
Hey everyone. Let me know. Can you guys hear me? Okay, good. I'm in my car right now. So my name's Keon Mitchell. I just graduated residency at UC Davis. I did OBGYN, and my plan is to be working at Kaiser and OBGYN down in Southern California, hopefully within the next month. I'm in the final stages of interviewing. And I've been involved with CAPA/CAPSA probably since 2009. I went to, I think it was a conference that CAPA was doing in 2009 as a student, an undergrad, and then just kind of heard about single payer and got to learn from the different providers there, a lot of the policy experts, and then it kind of just made sense to me that that was, single payer universal healthcare was something that we should be doing or advocating for. And then I kind of learned a little bit more about, how the United States, spends the most money on healthcare, but doesn't necessarily have the greatest outcomes or greatest quality measures, and has high significant rates of maternal mortality. And then I was a biology major. I didn't quite know what I wanted to do. During this time, it was also the stock market crash. So it's like, should I try to find jobs? Should I go to school? Should I apply to medical school? There was a lot of different things that I didn't know that I wanted to do at the time. What I did know was that I did want to continue advocacy efforts in regards to healthcare. So I looked for graduate schools that had health policy and clinical health experience. So I did a 2-year master's degree at USC doing clinical health and health policy, and got an MSW. In between my first and second year, I then was like, hey, I want to go to medical school, kind of with the background that I had and understanding the biopsychosocial perspectives of people's healthcare. And then I applied to medical school, and then matriculated to, well, the plan was to matriculate a year after I basically took a year off, and then I was looking for something to do, and then CAPSA looped back around into my career goals, and I saw that they were recruiting for someone to run CAPSA. So I was the CAPSA coordinator from 2013 to 2014, and then went to medical school shortly after, and was lucky enough to get accepted to UC Davis, and kind of just kind of worked through a chapter at UC Davis, just continue to advocate and, kind of be on the periphery of a lot of the movement, because as you know, or as many of you will know, and those who have gone through medical school is pretty challenging. And then after that, after I graduated, went to residency, and within residency, I joined the board of CAPA. And basically I've been on the board for a few years now. And just really excited about the opportunity to continue to do this work. I think one of the pivotal things in my kind of tenure with CAPA and CAPSA was when I was the CAPSA coordinator. I think we were trying to find a way to continue to advocate for single payer, and also to make sure that we weren't being left behind, so to speak, in the movements that were going forward. And around this time, as was mentioned before, the Affordable Care Act, or Obamacare, was passed. So we kind of found it upon ourselves to continue to advocate for single payer, but also try to get as many people insured as we could, because we know that that's one of the routes to get everyone covered, with the hope of getting access to health insurance. And I think we've been talking about it for the last, hour and a half. There's many different ways to get everyone access. And there's many factors that go into that. So I, kind of talked to the executive director at that time and said, I think we need to continue to advocate through the Affordable Care Act, and to try to find ways to continue to provide access and care for folks. And so much great work has been done since then, as a lot of the work you guys have heard. So that was one of the pivotal moments for me. That was really exciting, because I think it was kind of like, should we just stick with single payer and continue to advocate for that? Or should we advocate for that and also try to find other ways for people to get access? And yeah, I've just continued to do the work. I think the omnibus bill was mentioned earlier. So that's one of the things that's kind of important to me too, especially in the work that I do as an OBGYN. And one of the pivotal things in that was also, there's going to be hopefully an advancement of telemedicine or telehealth for patients. As we've seen, COVID has made a lot of a shift to doing healthcare virtually, via phone, via computer, other ways. So that's one of the things that I've also been working on, and I did my residency research on, and my grand rounds on. So if you guys have questions about those sorts of things, I can talk about that too, and how it might integrate into making sure that everyone has access to healthcare. And I think I went kind of over my time. So if you guys have any questions or want to reach out to me, definitely you can call me, text me, give me a chat or anything like that.
I'll take advantage. Thank you so much. A question I have for you. I heard that you had an MSW. That's a Master's of Social Work. Social workers know about relationships. Do you think that training has helped you, will help you in bringing people together because everyone needs healthcare. I don't care your political beliefs, religious beliefs. We all have the same pumping hearts. We all need food. Anyway, could you just comment on what you might bring that special to the movement?
Oh yeah, absolutely. So I think when I was transitioning from social work to medical school, it was a little bit challenging for me because my skill set was more geared towards social work. So I had to learn how to be, you have to learn the medicine, you have to learn all those things. So I had to learn how to be a physician, so to speak. So that was a little bit of a challenge. However, when I got more skills and more knowledge in regards to how medicine played a role in people's health, then I felt like I was able to integrate more of the skills that I had developed as a social worker. And I think as far as one-on-one patient care, it's helped me tremendously. And then when you take a step back and leave the office or, your clinical encounters, I think it also helps building connections with other colleagues. It helps building connections with other organizations. So coalition building, and even just talking to people, and trying to understand what their perspectives are. Because I think at the end of the day, we talk about healthcare being a human right. We talk about, people deserving, access to making sure that they're healthy. And along with that, you talk about like food deserts. You talk about, can people afford to pay for parking when they go to their appointments? How many buses do they have to take to get there? So I think those are all factors that go into it. And if we can reach out to multiple organizations that are helping do those things, then we can provide the medical care, we can provide our voice, we can provide our advocacy in that way. But we're also asking other experts to jump on board and help us with those other things. So yeah, I think it's been tremendously helpful on an individual micro level and also on a macro level. And I think it will continue to be as well.
Wonderful. Thank you so much. Looks like Dr. Kratzer has a question for you. Go ahead.
Well, actually, no, I'm volunteering to be the next speaker. Now, questions for Keon could go on forever. He's wonderful.
Go for it, Dr. Kratzer.
Okay. I want to notice one further advance in CAPA, and that is the successful passing of the Vice President's baton from me to Yelenia Palacios. I'm very excited about this advance in CAPA. And I've been a single payer advocate for 74 years, starting in the womb. My parents advocated many things that are still issues. So single payer was top, but there was gun control, there was all sorts of things that are still with us. But there have been advances, not as much as we would like, but there have been advances. But this is a huge advance in my mind. On this call, I see many old friends and many friends who are old. I also see young blood. And the great news for this organization is the young blood. None of this is going to last forever. I'm not going anywhere right now, but who knows? And so I am so delighted with this advance. And as an aside, if anyone is wondering what benefits accrued to CAPA from the schism from PNHP, I'll point out a couple of them. One is the roadmap, which would not have happened. And another is health access. We have a long history of collaboration with health access. PNHP squashed that. And so when we emerged from that unfortunate relationship, we are now partners with Health Access again. And I believe Health Access has always been a great organization. I'm delighted that we are partners again. That's it.
Thank you, Dr. Kratzer. And for that's hot off the press about Dr. Palacios, now our new vice president. Great to hear. And fortunately, there is so much work to be done. There's room for everybody and every approach. And we know that there can sometimes be between groups or among groups or people fortunately, everyone's keeping their eye on the goal and we're all working to get there. So thank you for that historic comment. And as B has pointed out, you know, there's work for everyone. We're all going to have to work together to achieve these goals. Great. Well, I'm quickly checking if there are any other CAPA members whose hands are up. I don't see that, so I'm going to take up the prerogative of calling on Dr. Lee, who, and by the way, I'm talking from Seal Beach in Southern California, or as the surfers say, Seal. I'm calling in from Seal. And I believe to hear more, and Dr. Kratzer, you're there in Fresno. So to hear more from up north, I think, Dr. Lee, you're up north. Are you willing to just share a little bit about your background, how you got into this advocacy with us, please?
Sure. I'm going to echo Dr. Kratzer. Seeing the young people in this organization is really inspiring. I really enjoy that. My background, I got interested in simplifying insurance by when I worked in the Indian Health Service, and this was back starting in 1969. There, we didn't worry about pay for service at all. So I left that experience wanting to expand in primary care, and I went to Martinez here in Contra Costa County on the Bay, way up north here, and was inspired by the founder of our residency program, who had during World War II volunteered to join the Canadian Medical Corps and wound up in London. And so he has this background in Canada and in London, and where National Health Plan was being talked about. And he'd grown up in Richmond too. And so he saw Kaiser develop. And so at our system, he decided, you know what, now we're in the 70s when I arrived. He said, we're going to go to capitation, not fee for service, because fee for service is just a waste of billing. And so that's been kind of my cause, seeing where healthcare should go, looking at the model of the National Health Service in England. The other thing was when I arrived in Martinez and worked in a county system, also up north here, is Oakland. And I had done my internship at Highland in Oakland, and what a contrast. They had no outreach. Our founder had outreach clinics in primary care throughout the system. Highland didn't have that. Highland was still in the dark ages in the 70s. Since then, a lot of counties have gone to a capitated system for Medi-Cal. And that's where I see the future eventually going for an efficient healthcare. And I noticed, and I was very pleased to see that the CAPA roadmap includes some paragraphs on capitation as an option. Obviously, you have to build up to it. But that's my background in a nutshell. Thank you.
Thank you very, very much, Dr. Lee. I'm going to call on, we have time for one more person before we close right at noon. And
I just wanted to say, nice to finally put a face to your name, Dr. John Lee.
I second that. And we have time to call on one more person. We've got 8 minutes left before we finish. And I'd like to call on one of the first people I met in the movement 20 years ago, a Dr. Bruce Hector. Bruce, are you willing to speak up a little? Are you on the call? Okay. Well, another name I recognize, but I have never met, is Dr. Susan Davis.
I think Dr. Hector just unmuted himself, but we don't
great.
see you.
Aloha.
Okay.
There he is.
Go for it,
Hi,
Bruce.
Hillary, and everyone else. Hi, Jim. I've seen many of you long time. Thank you. And Bob Vinetz, yes, you're looking well. Thank you. I've been involved in CAPA and PNHP for 15 to 20 years, and in the San Fernando Valley with Healthcare for All. It seems like an endless fight. We make a few steps, we step backwards. I'm particularly concerned now that I'm of the Medicare age with what's going on with this DCO REACH Act and the attempts to privatize Medicare. At this point, I'm retired, but I want to see this movement through to the end. So I hope we'll make it sometime, but we got to keep putting up the good fight. Thank you, everyone. And I'm delighted to see the younger folks participating more and more in all of the organizations. I always felt it was terrible that the people who had the best coverage were the people who were fighting for everybody else. And now I see that we've got young people who are picking up the mantle for us old folks, but we're going to stick with you no matter what. Thank you, everyone.
Thank you, Bruce, for those words. And I also see Dr. Tina Cho on the call. Tina, are you able, can you hear us? Are you able to just say a few words? We'll see if she can unmute.
Hi.
Hi.
Yes, hi, everyone. I just think it's fantastic what's going on, and you know, the hard work of so many people and the excitement in the movement. And you know, like what was mentioned before, you take some steps forward and some steps backward, but hopefully we can move together in a net positive direction and reaching some type of universal coverage for all in the future. And you know, the steps may be difficult, the progress may be difficult, but I believe we'll get there one day.
And Tina, do you just want to share in a minute how you got into this whole advocacy role?
I've always believed in the single payer approach. I've seen a lot of the inequities in the healthcare system with access and quality of care, and my whole career has basically been working in underprivileged communities and advocating you know, for those who are homeless with mental illness. I worked in downtown Skid Row. I've worked in South LA. I've worked in, you know, largely Hispanic communities and my own Korean community. So I feel like I'm multicultural as a adoptee of many different ethnicities and countries. And I think we can gather something positive from every ethnicity and every culture, and every one of different genders, disabilities and abilities. And we should learn to try to be more tolerant and embrace people. You know, I think, you know, right now we're preaching to the choir. It's the task and the challenge is reaching out to those people who are very much against the single payer system, who have their own prejudices, who have their own fears that, you know, we're going to be subsidizing immigrants or people who do not contribute to the system in any way. So there's a lot of misinformation out there. And I think the challenge is to educate the public at large, because everybody here is on the same page for the most part. And I think we just have to talk to our neighbors, to our friends, to people who really have a lot of fears and concerns about expanding healthcare coverage or adopting a universal healthcare system.
Very, very, very well said. And everyone, Dr. Cho is a psychiatrist. So that brings another area of expertise to the movement. And yes, we may be preaching to the choir, but guess what? We're practicing our voices. So the
I agree.
choir works in unison. So we become
Yes.
louder and beautifully nuanced in sync. So that's great. Well, to finish up, thank you, everybody. It's just wonderful. It always energizes to get together like this. Also, just quickly want to remind you that we're a nonprofit, and if you liked what you heard here or are in a position to donate anything, please do so. And I would like to turn it over to be just to finish up. And again, thank you, thank you. And I carry a message from Dr. Steve Tarzinski, our president. He had wanted to be here today. He was going to, the electricity went out, a big thing blew on a telephone pole or something, and they're fixing it. But he sends his regards and appreciates everyone's efforts in being with us today. So go ahead, B.
Yeah, thank you so much. Oh, this is so great. And yes, you know, when I came to CAPA was as a student organizer when CAPSA was just born back in 2009 or 2010, along with Dan Lichtenstein Boris, who you heard from earlier today. We were the first student organizers, and we were actually in the Southern California chapter when CAPSA had just two chapters. Okay, now we're 18 campuses and moving forward, CAPSA, that is, moving to establishing new chapters throughout many different colleges, universities, and community colleges in California. And back then, I remember hearing, we're preaching to the choir, we're preaching to the choir, we're preaching to the choir. Sure, we can continue saying that we're preaching to the choir, but I would say that we need to have these conversations and people are listening, because within our group, there might be people that are not too sure, you know, should they get involved in this movement? You know, there's so many issues, right, that we need to address. And when we hear these conversations over and over and over again, and you make people feel part of the group, these people that we're preaching to, the choir, stay. We stay for years, okay? And we move the movement along. So yeah, we could be preaching to the choir, but it's not just preaching. We're strategizing, we're organizing, we are planning to move forward. So that's what I wanted to say. Now I want to turn it over to Yessie because she has a request for us.
Thank you, B. Yes, I would love to capture this moment. I know we're all in little boxes, but I think it would be nice to take a screenshot of whoever's, you know, able to turn on their cameras and show us those big smiling faces. I think we had a really great meeting today. And yeah, so just for our memories, and we'll be posting it on our social media. So if y'all don't mind, okay, I'll let y'all get settled in and then I'll count to 3. Okay. B, I think your other camera's on. Okay. Okay, I'll count to 3. 1, 2, 3. Oh wait, I don't know if should I retake it?
Yes, we got another
take
person.
a lot of them and then we'll pick the right one.
Okay, B, I don't see. Oh yeah, there you are. Okay.
Yeah.
1, 2, 3. I love the shirt, showing the shirt, Dr. Custer.
Yes, I love it. I love it.
Okay, great. I think I got it to whoever wanted to turn their camera on. Thank you all so much. And then I'll hand it over back to B.
Yeah, thank you.
And I have one surprise. We're not only preaching to the choir, we're preaching with the jazz musicians. If people want to stay 1 minute, Bernie Nadell is our trumpet player, and he is willing to play a little interlude for us. Music is universal. And B, this comes as a surprise. If you have any last comments, I don't mean to interrupt.
I wanted to give a last comment. And when I saw Bernie, because Bernie, he could make it, which we were really happy that he could make our call today. I thought about it and I said, oh, Bernie, can you play? Do you have your trumpet close to you? So I'm happy to hear that. I just wanted to thank everyone for attending. There are so many things that you can do for our movement. Please stay in touch, come back, get involved, read our blast, send an email, say hello. We have monthly membership chats every second Tuesday of the month at 7 p.m. We send out a registration link. We would love for you to just come in, chat with us. There is nothing formal. We don't have an agenda. We talk about issues that happen in the moment sometimes. And it's, we want to also give an opportunity for you to get to know our staff and for our staff to get to know our members at a closer level. Our information email is in the chat. Somebody will put it, Bethlehem will put it. It's info@caphysiciansalliance.org, and you can send us an email there, and our wonderful administrative assistant, Bethlehem Manakalu, will send it out to the appropriate person. I want you to say the date, and if Bethlehem, you can share the screen for this, is to save the date for Kappa's 35th birthday party, which will take place on, it will happen on Saturday, October 15th. We don't have a time yet, and we are unsure whether we'll do it in person here in LA because our office is in LA, or if we will do it virtual or perhaps hybrid. We've never done that before, but we will let you know. So please put that date in your calendar, Saturday, October 15th. And with that, I'd like to end this. Thank you so much. And if you can't stay to listen to a little concert from Dr. Bernie and Adele, we would love to have you stick around. Thank you.
Okay, can everybody hear me? This is only going to be a couple of minutes, so.
Yeah.
Go for it.
All right. I'm going to play a little tune called It's called Work Song by Nat Adderley. Some of you may know this. Was well known by the Cannonball Adderley group, and Nat Adderley was Cannonball's brother. And there you have it.
You can all unmute yourself and clap so that we can hear you.
Great,
Bernie, that was great.
excellent performance.
Thanks,
And Bernie,
everyone.
Thanks, everyone.
Bernie, people were commenting on your background, which is lovely, and it's perfect for California.
Excellent.
Happy to give you a few minutes of it.
Well, everybody enjoy your Saturday. I will say if anybody has any last minute questions or comments, yeah, thank you. Thank you, Bethlehem, for posting in the chat. I think we could go ahead and stop the recording now.
Okay, but Bernie,